primary care physicians, there's two important roles. One is identifying the patient who has symptoms of MS, because they can be transient, they could be ephemeral, and not necessarily what some would ordinarily expect. And sometimes patients will blow it off themselves. You know, they'll have some numbness and tingling in their legs for a couple of days and it went away. But if they mention it to the primary, then he ought to think, well, what is that? Because that's their spinal cord. And even though it went away, what's a harbinger of? So we want them to know how to diagnose MS, not to find diagnosis, but how to recognize that the nervous system needs to be explored further. And then the second is to have an understanding and partnership with us on dealing with potential side effects and safety and future occurrence of events, because we like to partner with the primary care guys because that's where the patients are going to be seen. And if someone calls up, for example, with a new cough, now normally that may not get anyone too excited, but if they're on a drug that's already suppressing their immune system to some degree, we tell the patients, and we want their primary care doctor to understand that maybe you need to look a little harder and a little quicker for an infection than you would in someone who wasn't taking one of these agents. So for us, partnering with primary care physicians is important, because people working at comprehensive MS centers see people coming from a great distance. And this is true all across the country, especially when you get into the Midwest and the West. People go a long ways to get to a medical center. And so we need to partner with the doctors that are close to them so we can get them seen rapidly, and that they recognize that this may be either due to their illness or a complication of their therapy.